made today, this sounds like a good idea. And I apologize to Manitobans if this is a reason why it's so cold out right now, because you have the Premier and I agreeing on something for once. But this travel restriction that's being put into place at the provincial level, and this ask of travel restriction at the federal level on international travel, I think is something that we need as part of our overall public health strategy. So this sounds like a good idea, but I would call on the Premier to use this time to further invest in our healthcare system. Premier today spent a lot of his time talking about variants possibly coming to Manitoba. Well, what we've learned from this brutal experience that we've had through Code Red so far is that one of the most important things that we can do to help us keep Manitobans healthy and at the very least alive during this period is to have a strong intensive care unit system in the province. That means having the nurses ready to staff it, the physicians available to staff it. It means having the equipment. It means having the pharmaceuticals on hand, all the other resources. Of course, we need many other healthcare resources in the hospitals and in the clinics. So while we have this period of time, perhaps that these travel restrictions could buy us before variants potentially arrive in Manitoba, let's use that time to build up the healthcare system, particularly in those areas where we saw this fall and winter that we're barely hanging on. We just came through a period where our intensive care units were basically only working because of the heroic and Herculean efforts of nurses and doctors therein. It's not sustainable. We need to train more nurses. We need to train more doctors. So again, the announcement that the Premier has made today, this sounds like a good idea, but let's use this time to make the investments in our healthcare system so that we can withstand what's coming potentially as the pandemic drags on.